All right, Claire, we're good to go.
Awesome, and I'm starting the webinar now. Hello, welcome to our webinar series, Building a Better America, a Small Business Resource Community. We will be starting momentarily. Just feel free to come in and get ready for a great webinar. Thanks so much for joining us. And to all of those who are just joining, we will be starting momentarily. Thank you so much for joining us to this webinar. All right, we are going to go ahead and get started. Welcome to Building a Better America, a small business resource community. We are so excited that you have come to join us today. Just a few housekeeping before we get started. If you have a question, please make sure to type it into the Q&A. And then the U.S. Small Business Administration does not endorse Public-Private Strategies Institute. This session will be live streamed and recorded, and we'll make sure to send over the copy of this and the slide deck to all of the participants after, so no worries about writing it all down. And then another thing we'd like to remind everyone of is to please not share any personal information in the Q&A function. Thank you so much. We really appreciate it. And now I have the honor of introducing Senior Advisor, Miss Renee Johnson.
Hello, everybody, and welcome to Building a Better America, a small business resource community, a webinar series brought to you by the U.S. Small Business Administration and Public-Private Strategies Institute. Today, we are happy to discuss community initiatives and uplift with a discussion covering resources to help your businesses thrive. We're excited to have each of you here for the U.S. Small Business Administration's webinar series, which is Building a Better America. Our goal today and across the series of events is to connect small businesses with critical resources and information. If we can go to the next slide, please. Information about the Biden-Harris administration's policy agenda, including how the Inflation Reduction, bipartisan infrastructure laws, and American Rescue Plan create opportunities for small businesses. Let's go to that next slide. Today, I'm excited because we're going to first give you updates from the administration and then talk about those resources. But first, we are going to have a conversation about enrollment for healthcare as well as COVID-19 updates. And first, I would like to introduce you all to Dr. Jose Romero, who is the Director of the National Center for Immunization and Respiratory Diseases at the CDC. Dr. Jose Romero, who is the MD, FAAP, FAAS, FIDSA, and FPIDS, is the Director of the National Center for Immunization and Respiratory Diseases, where he leads the CDC's effort to detect, prevent, and respond to vaccine-preventable and respiratory infectious diseases and threats. Dr. Romero has been active in public health and clinical research for more than 3 decades. As a professor and clinician scientist, Dr. Romero has made important contributions through his nearly 200 publications and extensive work on antivirals, surveillance, and other diseases. Dr. Romero is passionate about improving the health of underserved communities and addressing health equity. And with that, I present to you Dr. Romero.
Thank you very much for that kind introduction. And good afternoon. Thank you all for inviting me to present an update on the elevated incidence of multiple respiratory illnesses we are currently observing in the United States. Before I begin with that review, I want to take a moment to recognize healthcare and public health workers who have labored tirelessly over the last 3 years to provide us with information, vaccines, health, and access to services during this very critical period. Forgive us. We're getting a lot of feedback here. Okay. Forgive the noise, forgive us. It's an understatement to state that this has been difficult last 3 years, but unfortunately now we are facing again another surge in illnesses. We are at a moment where we are potentially overstressing our healthcare facilities. As COVID-19 activity is decreasing, the United States is experiencing a resurgence in the circulation of non-COVID-19 respiratory viruses. CDC is tracking elevated levels of influenza, respiratory syncytial virus, which I will now refer to as RSV, and enteroviruses and rhinoviruses. Last month, the CDC issued a health alert network communication, also known as a HAN, to thousands of healthcare providers about early elevated respiratory disease incidents caused by multiple viruses, and especially among young children, and that is and has been placing a strain on our healthcare systems. A co-circulation of RSV, influenza viruses, and SARS-CoV-2, along with others, could place more stress on our healthcare systems as we move into the fall and winter. We are also concerned about the low influenza vaccination coverage we're seeing at this current time. So let me begin with respiratory syncytial virus, or RSV. National trends in RSV activity suggest that the peak of seasonal activity has passed in nearly all of the HHS regions across the United States. RSV-associated emergency room or emergency department visits among people of all ages appear to have plateaued and are decreasing. Though RSV-associated emergency department visits remain at or above the level of a typical winter peak. So we're higher than we usually are. As typically seen throughout the year, children less than 4 years of age, especially those under 6 months of age, have the highest rates of RSV-associated hospitalization. And compared to previous years, these are also more, there are also more RSV-related emergency department visits and hospitalizations in older children. In preliminary analyses among children that have been hospitalized, we are not seeing indications of increased severity of disease among children who have tested positive for RSV this year compared to the 4 pre-pandemic season, even accounting for co-infections, that is, infections with other viruses in addition to RSV. Based on data from the new vaccine surveillance network among children greater than 5 years of age hospitalized with RSV, 37%, or 1/3 of them, have co-infections, that is, an infection with another virus at the same time they have an infection with RSV. And this is compared to 17% in the 4 previous years prior to the pandemic, so almost double the number that we were seeing before. Increases in seasonal influenza activity continue nationwide. The CDC estimates that since October 1 of this year, there have already been at least 8.7 million illnesses due to influenza, 78,000 hospitalizations, and unfortunately, 4,500 deaths as a result of influenza. Hospitalizations for influenza continue to be highest that we've seen at this time of year in more than a decade. As our most recent reporting week, clinical laboratories are seeing 25.1% positivity rate for influenza. This is an increase of 6.9% from the week prior to this. The majority of influenza cases or viruses detected so far this season have been of influenza A type H3N2. And this represents 79% of the viruses that have been identified. Those that have been subtyped also show that 21% are of influenza H1N1. Additionally, last week, and unfortunately, we tragically reported 2 more flu deaths in children, now bringing the total to 14 pediatric deaths in this season alone. Influenza vaccination coverage, with regard to the national influenza vaccination coverage, this week is National Influenza Vaccination Week. It's observed at the beginning of December for each year to increase awareness about the importance of influenza vaccination ahead of the holiday season. This is especially important this year as we have been concerned about the lags in vaccination coverage that we're observing. And this coupled with the early elevated influenza activity across the season could portend a significant year of influenza disease. CDC is concerned about the lower rates of vaccination for influenza coverage that are being observed so far this season. And this is compared to the pre-pandemic seasons. So for example, for adults, we're approximately 2.4 million doses administered behind what we saw last year at this time. These are doses administered in physicians or healthcare providers' offices and pharmacies. This is 4% lower than last year. For children, while the coverage looks the same as it did last year, I have to remind everyone that last year we were 5.5% lower in coverage than we were in the pre-pandemic years. With regard to pregnant people, 12% fewer pregnant people have been vaccinated now compared to this time last year, and about 22% less than this time pre-pandemic the pre-pandemic year or the pandemic year of 2020. The data show historically that influenza vaccination uptake decreases after the holidays. So CDC has been increasing its communication regarding the significance of obtaining influenza vaccination. With regard to vaccine effectiveness, it's very encouraging to know that the currently circulating vaccine, influenza vaccine viruses are well matched to the vaccine strains in this year's vaccines. We also have data from Chile, published in the recent Morbidity and Mortality Weekly Report, that shows that vaccination reduced risk of hospitalization caused by influenza A H3N2 by 49%. And as I mentioned before, this virus makes up nearly 80% of the viruses we've been able to identify so far. Excuse me. Turning now to COVID-19, CDC also continues to closely track COVID-19 activity. In the past week, we have started to see the unfortunate and not unexpected rise of COVID-19 cases and hospitalizations nationally following the Thanksgiving holiday. This rise in cases and hospitalizations is concerning as we move into the winter months, when more people are going to be settling indoor with less ventilation. And as we approach the holiday season, you may be gathering with loved ones of advanced ages across and multiple generations. As of December 2, more than 98.7 million cases of COVID-19 have been reported in the United States. COVID-19 vaccinations and treatments are the best protection against serious illness from this virus, but uptake of the new bivalent booster has been low since the CDC recommended its use in September of this year. More than 39 million people over the age of 5 have received an updated booster vaccine of COVID-19, but that's only 12.7% of the US population. Hundreds of millions of more people need to be vaccinated and be brought up to date with their COVID-19 vaccines. So in summary, I want to leave you with key steps that we can all take to reduce the burden of respiratory viral illness as we move past the fall and into the winter. First and foremost, get vaccinated. 2 of the 3 viruses I've discussed have effective and safe vaccines for their prevention. The updated bivalent COVID-19 vaccines, flu vaccines, are safe. They can lower the risk of infection and in general, specifically in the severe cases and death can be reduced dramatically. Early surveillance shows that people who received their updated COVID-19 vaccine were nearly 15 times less likely to die from COVID-19 compared to people who were not vaccinated, and were less likely to die than those that were vaccinated but did not receive an updated COVID-19 vaccine. Take everyday preventive measures, covering your mouth when you cough or when you sneeze. Stay away from individuals who are ill. Staying home if you're sick, and washing your hands and improving ventilation at home are some of the ways that we can prevent infections. As we approach the holiday season, togetherness, family, community, and connection are now more important than ever. To achieve that in good health, it is critical that we take the steps listed previously to protect ourselves, our loved ones, and our community. Now, I will turn it back to Ms. Renee Johnson.
Thank you so much, Dr. Romero. And for all of you who heard those amazing facts and want to share this information, this is being live streamed to our Facebook pages for the SBA and PPS. In addition, we're also going to send an email out to all of you that you're going to be able to share and see this video again, as well as the PowerPoint tomorrow. And so thank you again, Dr. Romero. We truly appreciate you and all of your team there for all of the things that you are doing to keep us safe. Now I'm excited to introduce you to Jeffrey Rue, who is the Deputy Director for Policy Center for Consumer Information and Insurance Oversight for the Centers for Medicare and Medicaid Services. Jeff Rue leads the center's work promulgating policy and regulations for many of the Affordable Care Act's health insurance reforms, including the health insurance exchange, the premium stabilization programs, advanced payments of the premium tax credit, and cost sharing reductions, the co-op program, regulation of qualified health plans, and eligibility and enrollment standards. He oversees the center's communications, stakeholder outreach, and data analysis work, and serves as a member of the center's senior leadership team. He previously served in various policy positions at CCIIO as an attorney at the law firm of Covington and Burling, and as a management consultant with Oliver Wyman and Company. He received an AB in economics from Harvard College, a JD from Stanford Law, and an MBA from Stanford Business School. And with that, I present to you Mr. Rue.
Thank you so much, Renee. Thanks to the SBA and PPS for putting this event together. It's a great opportunity for us to get out there with all of you and share some of the work that is going on and some of the options that the small businesses have for health coverage. I think it's very timely for me to get to speak after Dr. Romero. I think the statistics and information that he provided really sort of brings home the importance of health coverage. I'd like to spend a few minutes talking about insurance, the uninsured rate within within small businesses, and then some of the options that are available today and newly available because of some of the laws that the new laws that Renee mentioned. And I'm really happy to report that I do think that CMS can be a big part of the solution to many of these insurance challenges, and there's a number of mechanisms through which that can happen. Now, of course, we know that today employers face a lot of challenges with respect to finding and retaining talent. It's tough to hold on to long-term employees, to hire new employees with the right skills. We certainly experienced that within CMS, and health insurance is absolutely one of the tools we are told and know over and over again that employers can use to attract and hold on to talent. This gets particularly tricky with the increase in remote employment, with relocation of employees that has happened in recent years, and providing that kind of coverage in across all of those locations maybe is easier for a large enterprise that has locations all over, but can be challenging for small businesses and small groups. We do know that the rate of uninsurance among Americans who work at small employers is higher. In 2017, so pre-pandemic, that was almost 20% of employees who work for businesses. I call them small group, but really we're talking about businesses of 50 employees or fewer. 20% of those employees did not have health insurance. Now, of course, there's good news here. The rate of uninsurance nationally is at an all-time low. We have been able to continue driving that number down. The rate of employment, but all that said, as there are shifts between forms of coverage, we do know that the rate of employment-based health insurance coverage has dropped by more than half a point between 2019 and 2021. We know that this is a challenge. Affordability is a challenge for small businesses, but the Biden-Harris administration has absolutely made making coverage choices available a huge priority throughout the time that it has been in office. To start with, let me talk about the small group market. So for folks who are involved or track this stuff, there are different segments of commercial insurance that we speak about. We speak about sort of big employers, but here again I mean sort of employers with more than 50 employees. We call that the large group market. Smaller employers, so 50 and under, we call that the small group market. And then if you go and try to purchase insurance by yourself for you and your family, that's called individual market insurance. So to start with the small group market, this was sort of the traditional way through which small businesses purchased health insurance when they could for their employees. The good news is that mechanism continues to be available. We have tended to see premium increases relatively moderate, lower than we see in these other markets over the last number of years. So that is good news. Under the Affordable Care Act, so this is a mechanism that has been in place for some time now, the Small Business Health Options Program, we call them SHOP plans, offer quality, affordable health and dental coverage. This is qualified health plans, QHPs, and small employers can pick among SHOP plans. There continues to be available a tax credit. It's not a gigantic credit, but it's the Small Business Healthcare Tax Credit that's available to employers for a number of years when they initially sign up for SHOP coverage, and that can be worth up to 50% of what the employer contributes towards premiums. And so I do think that a number of firms find that tax relief helpful. We also recognize, though, that for many small employers, the small group market is not the right fit. The availability of these plans in different parts of the country changes. The employer's ability to make significant contributions to these plans changes. It may be that the employees are located in various places, and it's hard to sort of converge on a plan or a set of plans to offer. But there are other options. And here I want to talk a little bit about the individual market. So this is the market that even if you are not an employee or employer of a small business, you could just go and you can go to the exchange. You can go to healthcare.gov or the equivalent in a state-based exchange, and you can sign up for coverage. And well, let me say first of all that in the last number of years, there has been an option available through the individual market for small businesses. A number of years back, there was a program that we call it QSARA. These are a special form of HRA that is available to small businesses through which the employer can provide a tax advantaged reimbursement to their employees for premiums and other out-of-pocket costs. Under regulation a number of years back, we also created a mechanism called the Individual Coverage HRA, which is an even more direct pathway through which employers can choose to provide health coverage by simply making a fund of money available to individuals and telling their employees, look, you can take that money and you can just go ahead onto the marketplace yourself and pick the plan that's right for you, recognizing that perhaps if employees are scattered, that there'll be lots of different choices being made, or that employees have different needs in terms of the networks that they want, the level of coverage they want. This can provide that flexibility while allowing an employer to make a contribution there. We continue to update healthcare.gov, the application, the information that's available through the website to facilitate enrollment through this mechanism. Should a small business make that available. The application has also been updated so that there is a special enrollment period for consumers and their families when a small business newly offers them either a QSARA or an individual coverage HRA. And there are a number of tools available on healthcare.gov on the state-based exchange websites through which you can you can go and you can fill out the tool and you can figure out whether these are what your options are, whether these are the right plans, either for the employer in choosing whether to elect to do this, or for the consumer if they have been offered this option. The downside of the QSARAs and the individual coverage HRAs, also called ICHRAs, is that if you come into the market through a small business, a small group health insurance plan, then you are not eligible for the full subsidies that are available through these new laws. In the last couple of years, the American Rescue Plan and then now the Inflation Reduction Act have really increased very substantially the subsidies that are available for consumers to purchase coverage. Now, those subsidies mean that lots and lots of Americans have access to coverage through the individual market, just straight up sort of by themselves, whether or not it's part of a small business, to $0 or very low dollar premiums, and they can get good coverage. And so it is important to sort of figure out if you are the employer, whether it makes sense for you to provide subsidies, I shouldn't say use the word subsidies there, provide reimbursement for all of your employees to go out and pick an individual coverage plan, or whether in fact it's better to, if you want to sort of provide the assistance, you can just do it through through the paycheck, and then they can just go out themselves, not be firewalled off from subsidies, and purchase individual market coverage through the exchange, whether that's through healthcare.gov or through a state-based exchange. Two other points I want to mention quickly that are new this year. One is folks who follow this or who are real health policy nerds may have heard of something called the family glitch, and that is, I suppose, a technical term that encompassed a problem through which, under an earlier interpretation of the Affordable Care Act, if an employee was made an offer of affordable minimum value coverage from their employer, then the whole family was firewalled off from subsidies. The IRS has updated its regulation, its interpretation of this provision as of this fall. So there were several million family members of employees who we estimate were blocked off from subsidies because of this interpretation. That is now opened up. There are tools and there's information on healthcare.gov and on the state exchanges websites through which those family members can now go and enroll directly in coverage and be eligible for subsidies. And finally, the one last thing I'd want to mention is really an ask of all of you. The end of the public health emergency is likely coming reasonably soon, and what that means for various technical reasons around prior legislation that was passed in connection with the public health emergency, it does mean that millions of folks who are currently on Medicaid and CHIP, they'll be at risk of losing their coverage. Many of those folks, we believe, work for small employers. As that shift happens, as those folks get redetermined with respect to their eligibility for Medicaid and for CHIP, we know there are other kinds of coverage that those folks may be able to find themselves into, including marketplace exchange coverage, as I mentioned, or in these other pathways. We are really calling on sort of all parties, all stakeholders across the country to help all of those folks, help educate them, help make sure that they are finding their way into coverage. This is a very big coverage transition. We want to make sure that as few people as possible sort of fall through the cracks as this big transition happens. So that's that you may hear of this process called the unwinding process, the Medicaid unwinding, Medicaid redetermination process. That is a process that will begin in the months to come. And on this matter, we really look for everyone to help and make sure folks don't fall through the cracks. So maybe with that, that's perhaps a good place for me to end my remarks and turn the program back over to Renee.
Thank you so much, Mr. Wu. We truly, truly, truly appreciate it. And all the resources that you provided. And we're going to make sure that everyone has the links you talked about to ensure that people know where to go to enroll and if they have additional questions. So thank you so much for everything. Now we're going to turn to Dr. Meg Sullivan, who is the Chief Medical Officer and for the Administration for Strategic Preparedness and Response at the U.S. Department of Health and Human Services. She is currently serving in this role, and Dr. Sullivan is a board-certified pediatrician with extensive experience in public health, health equity, primary care, infectious disease prevention and control, and emergency response. Prior to joining, she served as a medical lead for COVID-19 response for the largest county in North Carolina as part of her role as the medical director of Mecklenburg County Health Department. Dr. Sullivan completed medical school at University of California, San Diego, and her residency at New York Presbyterian Columbia University Medical Center. She received a Master of Public Health degree from Johns Hopkins Bloomberg School of Public Health. And with that, I'm so excited to introduce to you Dr. Meg Sullivan.
Thank you so much for that introduction, and good afternoon, everyone. I'm incredibly excited to be here today as the Chief Medical Officer for the Administration for Strategic Preparedness and Response to first talk briefly about ASPR's activities and assets related to what we heard about from Dr. Romero, the surge of pediatric viral respiratory illnesses, and then talk a little bit more broadly about ASPR's ongoing efforts with the COVID response. So I know, as we also heard from Dr. Romero, this is just an incredibly challenging time from an increase in RSV and other respiratory viruses, including flu and COVID, and the setting of an already strained healthcare system and an ongoing youth mental health crisis. And at ASPR, we are working in incredibly close coordination and collaboration with the CDC, with our FDA colleagues and other federal agencies, and with our state and local partners on helping to manage the surge of respiratory illness by helping to mitigate hospital capacity issues. Briefly, we are monitoring capacity across the country, sharing best practices to reduce the strain on systems, and standing by to deploy additional personnel and supplies as needed. More specifically, as soon as ASPR started seeing the increase of respiratory illnesses in several regions of the country, we immediately reached out to our partners on the ground to better understand what they were seeing. And through this outreach and in collaboration with our CDC partners, we are tracking trends in the data and on-the-ground situation reports to help us anticipate and identify surges, peaks, and valleys in hospital bed capacity, while also working very closely with the FDA to monitor the supply chain for any potential shortages in medications and supplies. All of this helps to identify and work closely with those health systems that are experiencing a significant level of stress or strain as a result of RSV, flu, and COVID, and identify opportunities to provide support. Through October and November, ASPR hosted a series of virtual pediatric town halls for every HHS region and with representatives from every state, bringing together pediatric experts, children's hospital leaders, local and state emergency managers, public health leaders, as well as other key local, state, and federal partners to hear directly from them and capture and share best practices and provide an avenue to request further support. We stood up a webpage on pediatric surge resources to facilitate easy access to technical resources by states and providers, and are working across the US government and closely with states to engage health departments, provide direct technical support, and evaluate any requests for federal medical assistance, including supplies and personnel. I think I'll just note briefly that ASPR's technical resources are available to any state, and states are already utilizing these resources to mitigate hospital strain and help facilitate coordination between hospitals. And more information can be found on ASPR's website about these resources. We also stand ready to evaluate any requests for federal medical assistance, which is a process done in close coordination with the requesting state. These resources include medical supplies such as ventilators and personal protective equipment, or PPE, through the Strategic National Stockpile, testing supplies for COVID, RSV, and flu, and medical personnel through the National Disaster Medical System or other federal options. And states are working closely with ASPR regional staff to learn additional information. And, I do want to take a moment to highlight the work of states and healthcare providers across the country who are truly using innovative strategies to support their health systems, and by doing so, really saving lives. And I think with an increase in RSV infections, a rising number of flu cases, the ongoing burden of COVID-19, there's no doubt we will face challenges this winter. We also know, in addition to our healthcare system, how challenging this is for parents and caregivers. And just to take a minute to emphasize what my CDC colleague, Dr. Romero, stated, it is really important to remember that RSV and flu are not new, and that we have safe and effective vaccines for COVID-19 flu. And as he stated, we need to encourage everyone, including parents, caregivers, families, and children, to receive. And I just want to end this section by saying that ASPR and all of our federal partners are committed to continuing to work closely with states and provide support however we can. I also just wanted to take a few minutes to talk more broadly about ASPR's ongoing work with the COVID-19 response. In addition to what we just talked about, we know that COVID-19 is still a great presence in our communities, and it's critically important. Again, I'll say that we all continue to get vaccinated, including receiving the most up-to-date COVID-19 vaccine and developing our own COVID action plan to assure our households know what we should do should anyone become ill from the disease. Just a reminder that anyone should visit covid.gov to learn where you can find vaccines and treatments in the community. Specifically at ASPR, we have distributed PPE and other supplies from our Strategic National Stockpile. We have shipped tests through covidtest.gov. We have invested in domestic manufacturing of critical supplies to create a more resilient public health supply chain. We'll say ASPR and HHS, more broadly, remain focused on ensuring equitable access for all communities to COVID vaccines and available treatments. Since the updated COVID-19 vaccine received emergency use authorization, we have shipped nearly 85 million doses to a network of 70,000 plus administration sites across the nation and the globe. And in addition to the vaccines, there are treatments available for those who are high risk for hospitalization or even death as a result of COVID. And it is our goal to ensure providers are aware of these options for their patients, and that individuals who test positive for COVID are armed with that information they need to get treated quickly. In particular, there are 2 effective oral antiviral treatments that are available at over 40,000 locations across the country, including particularly as an additional option for individuals without timely access to their own healthcare provider, through a federal initiative known as Test to Treat, which offers a pathway for eligible individuals to be tested, see a healthcare provider, and if determined eligible, have their prescription filled on the spot, all in one convenient location. And this is important because time is really important for these treatments, as treatment must begin within days of a person's first COVID symptoms. And then from education and awareness to logistics, we've worked hand in hand with our partners, including many of you, to overcome challenges and get critical drugs where and when they were needed. We're still working to ensure equitable access to these products. We are also focused on the commercialization of COVID-19 vaccines and therapeutics. And since these products first received emergency use authorization from the FDA, we know that transitioning them to the commercial marketplace would need to occur in order to sustain accessibility to these products in the long term. So we are working with state and local health officials, manufacturers, and distributors to support the smooth transition of vaccines and therapeutics while we wait for the commercial market to ramp up its own production. And together, we are doing all that we can to ensure appropriate planning for equitable access to these products, especially in rural communities and targeted areas with high uninsured, underinsured, and low-income populations. We do know that all of this will require partnership, and we will continue working with all of our partners, including the business community, throughout this process and response efforts. And I just want to end by thanking you for all of what you do. Renee, back to you.
Thank you so much, Dr. Sullivan. And again, thank you for all those amazing resources like covid.gov. We will make sure that we make that link available for everyone after this webinar. Now we're going to turn to a small business owner out of Colorado, Mas Torito, who is the owner of Kokoro Restaurant. This is a family-started restaurant, a Japanese restaurant specializing in quick, casual, but fresh traditional Japanese food in 1986. Mas has been running it on his own since 2008. He has had 2 locations in the Denver metro area. A big part of his success has been in part because he sees himself as part of the community. He has many long-term employees, including some that have been with him for over 30 years. They buy local ingredients when possible, and they participate and help local schools, churches, and other community groups. In his free time, he has a passion for golf, skiing, and enjoying walks with his wife and their 2 dogs. Backpacking trips in the Rocky Mountains, his way of recharging. He personally can't wait to be able to return to some of his favorite social activities like Denver Broncos football games and concerts. So with that, I'm excited to introduce you all to Mr. Torito.
All right. Just waiting for the camera to turn on here. There we go. Hi, everyone. My name is Mas. Thank you, Renee, for the wonderful introduction. Yeah, my restaurant, my family's restaurant has been open in Denver for quite a long time, enough to see me as a 6-year-old little kid. And then now I've been running it since I was in my 20s, and now I'm in my 40s here. And yeah, we have about 50 employees over our 2 locations, very diverse group of employees. And we've seen our share of hard times. We've seen some really great times as well. But COVID was one of those times where we knew things were going to be tough, but we knew we had to make some changes and pivot. And it's been something we've been able to get through. So that's been wonderful. During this time, we've had to really switch how we would conduct your business. We would have these great employees that have been with us for so long and would give great service. But when COVID hit and dining rooms shut down, we had to completely change our way of doing business. And we focused mostly on doing a lot of takeout. We have a drive-through, so we put a lot of emphasis on that. And that's something that we really wanted to make sure that we kept our customers and our employees safe, but still maintained an open business. So COVID also hit us in ways that, you know, maybe you wouldn't think about. Mask mandates, fear of catching viruses really took a toll on a lot of our employees. So we really wanted to focus on providing a lot of mental health opportunities for them, the ability to take time off, make adjustments to their schedule, and give them tasks that were not necessarily so direct with customers. So we made a lot of changes, and we're doing quite well right now. So things are great. To discuss some of the points here about what our businesses have been doing, we make sure that all of our employees get time off to take COVID vaccine shots, and we make sure that they have the time after their shots if they have any side effects to recover. Renee, what other things can we talk about here that you'd like to discuss?
Yeah, well, one, thank you so much, Mas. You know, being a small business owner during these last few years and actually creating a business is difficult and no easy feat. So thank you, your family, for one taking that sort of like risk and sharing your culture and your sort of, you know, reason to thrive with the world, right? But COVID-19 has impacted your community in Denver with your locations and your employees. And so you guys have specifically have helped your employees and your community learn more about vaccinations and provided them with opportunities to be vaccinated. I know we heard about a story about you reaching out to the Department of Health and Human Services and connecting with them. Are you able to talk about more about that and how you even came up with that idea of connecting to the government to sort of like assist with vaccinations to your community and employees?
Absolutely, Renee. You know, I think for us, being a Japanese restaurant with a very diverse employee group and customer base, you know, the vaccine came and hit our community so quickly. It was hard for people to know what to believe or what resources were really there or how to get help with either getting vaccinated or any other kind of government assistance they needed. And I found that if we as a business could provide some basic services, some basic information that not only our employees, but many of our community members that have come to us for donations in the past or involvement for, hey, can we use your space for an event here or there, really started to lean on us a bit more for resources. And then we'll say to ourselves, well, how do we get educated and informed? And, you know, turning over to our health department, I think was one of the biggest things that became a real big asset for us, is to say, well, how do we get COVID tests? When and where can people get vaccines? Will it cost something? What if they need to take that extra time off? What resources are there for them if that were to occur? Is the vaccine safe? What are some of the side effects? So we were being asked these questions, and being able to turn to our health departments really became key to us. And I think one part of it too is that we've really understand that there's a shift. I think many restaurants in particular with health departments have had that kind of concern of like, okay, is it us versus them in many years past? But my gosh, with COVID, it's a whole different mindset that we really had to embrace. And I suggest anyone listening here to really see that shift, is that the health department really is there to provide safety for all members of our community. And whether it was even just getting PPE materials for our staff, hand sanitizer, masks, the health department was great, and we wouldn't be in business if it wasn't for their help. So I think that shift really was a big key for us.
Wow, that's amazing. Want to shift a little bit to like what you can sort of like share with other business owners and tell them that would be helpful for them to be sort of like small business COVID leaders as well. Like, what could be one step that you would like to recommend that people could take away today?
Yeah, I would suggest it's becoming really familiar and reaching out and communicating with their local organizations, whether it be the SBAs, organizations in their neighborhood, their chambers, health departments, really kind of shifting themselves from saying something where you focus on requirements and rules and start seeing yourself as a provider of resources and education. That mind shift change really opens up a ton of doors. And as a small business owner, Still, one of the most things we're most concerned about is the bottom line and bringing customers in. But I can tell you, it's been a big success for us, for our customers to see us as saying, hey, you know, this is a safe space because we are educated, we are informed, we are aware of safety precautions that need to be taken. And therefore, you know, we're welcoming you into our restaurant. So instead of worrying about restrictions, it's more about resources. And that's really a big change that really has allowed us to thrive during COVID and this change.
Well, and my last question to you, because you hit a trigger word, which is resources. We know you're getting through this pandemic, and some people are saying we're at the end of the pandemic, which who knows what that even means. But what are some resources you are personally using, and what words of encouragement would you offer other small business owners who are feeling overwhelmed or discouraged today?
Well, I would say, yes, there's some ebb and flows, of course, to COVID. But as the prior presenters all pointed out, it's an ebb and flow. There's some things that are going up as other things are going down. And I think that's where we have to make a switch. I haven't even brought up to you, Renee, beforehand, but I have a brand new son. I'm a brand new dad with a 2-month-old baby who's on oxygen. And RSV is like the scariest thing in the world for me. So, you know, as much as we see some changes maybe happening with COVID, it's not about letting our guard down. It's about really understanding that we are leaders in our community. We have a responsibility to our employees, to our customers. And if we just kind of embrace that role a little bit more, you know, we're really in a position to really be the catalyst of change and really keep our public feeling comfortable doing business. You know, people trust small business a lot more than, say, big business. So because we have that connection, you see my face, you know who's impacting who's helping who, how I can help you have a great dining experience is how you can help me survive as a business. And we just always remind ourselves of that, and things will be okay.
Well, congratulations. And we know that we are praying for you, your son, to have a speedy recovery, because I know that's probably scary to have a child on oxygen with everything going on, but you're still committed to the community, and the fire has not left you to ensure that your business is thriving, your community is thriving, and that you're still being a small business community leader. So you are a true leader in the small business world, and we thank you so much for all of your hard work.
Oh, thank you, Renee.
Thank you. Well, now we're going to just wrap up with a few items because we are almost at time. So we are going to share this PowerPoint presentation with everyone so that you'll have a copy if you registered for this webinar. So you'll get this email to you. It has clickable links in it, all of those things. So we're going to talk about additional resources for your business that you can use. So the Inflation Reduction Act. So on Tuesday, August 16, 2022, President Biden signed into law the Inflation Reduction Act, which lower costs for small businesses and working families. This was done by making, 1, healthcare more affordable, 2, leveling the playing field for small businesses versus those larger corporations, then also reducing the deficit, and then combating the climate crisis. I'm not going to get into the weeds because we're almost at time, but I want to highlight that the Inflation Reduction Act will not raise taxes on the vast majority of small businesses on working families. And basically, this is a law not funded in a way that by personal tax increases on small businesses or working families making under $400,000, which is roughly 99% of all Americans. And then additionally, the IRS promised that the investment of the enforcement resources will not be designed around the Department of Treasury's directive that will be able to impact businesses that are under that $400,000 threshold. So now we want to talk about healthcare as well. The IRA will make prescription drugs more affordable and helping innovation. The IRA will provide a 3-year extension through 2025 of enhanced subsidies for small business owners who are buying their own healthcare coverage through the Affordable Care Act marketplace. And as you heard today from Mr. Wu, there is open enrollment that's happening right now, so you can find out more information there. And then it also allows for Medicare to start negotiating the price of some prescription drug prices beginning in 2026 and caps Medicare Part D out-of-pocket costs. So the bipartisan infrastructure law, which was signed into law on November 15th, and we recently celebrated the 1-year anniversary, is basically the Infrastructure and Investments and Jobs Act, which was signed into law by President Biden, which made historic investments, which was about $550 billion in new funds for large infrastructure projects, supply chains, broadband, and drinking water. This is the largest investment in the nation's infrastructure since 1956. So there is about $55 billion in projects to deliver clean water, $65 billion to expand the country's broadband, $110 billion to repair and rebuild the country's crumbling roads, and then $90 billion in modernizing public transit. The impact of small businesses is that this law will virtually touch every part of Main Street across the country. The law expands access to tens of billions of dollars to federal, state, and local governments and contracting. The U.S. Department of Transportation is to award more than $37 billion in federal contracts, which is to support an estimated 700,000 jobs per year. And this is going to help small businesses hire new employees and reach new customers. To find out more about this, you can go to Guidebook, which is bill.gov. And again, we're going to email this out, so you're going to be able to click the link. The American Rescue Plan, which was signed in 2021, also known as ARP in the CARES Act, focused on helping small businesses and consumers. Support for communities that were struggling in the wake of COVID-19. The plan provided critical resources for those communities. It provided emergency grants, lending, and investments to hard-hit small businesses so they can rehire and retain workers. It distributed more than $360 billion in emergency funding for state, local, and tribal governments. Additionally, it helped hit hard-hit public transit agencies and avoid layoffs and service reductions, which disproportionately harm workers who are more than likely to be dependent on public transportation. The ARP also created the Community Navigator Pilot Program, which is at the SBA. It is designed to reduce barriers that underrepresented and underserved entrepreneurs often face in assessing the programs they need to recover, grow, or start their businesses. There was a total of $100 million in funding to over 51 organizations that were provided. Selected projects will cover diverse communities across the US and Puerto Rico, and the grantees will serve as hubs. Then there were centralized lead organizations, which will be incorporated, which were then the spokes. And those organizations, they have that built-in trust in their local communities. And the focus is to connect small businesses to critical resources and assistance, which all include financial assistance, access to capital, contract and procurement, marketing, operations, business development, and exporting, as well as industry-specific training as well. The tax incentive. Many of you may have heard of this, but the paid family leave tax incentive. Under this program, employers can offer up to 12 weeks of paid family leave, which can be used to be taken care of a family member or for maternity or paternity, or leave with biological or adopted children. In exchange for the leave, employers will receive much as 25% tax credit for the amount of wages. The policy is targeted to hourly employees who would not otherwise have access to paid leave. Employees who participate cannot make more than $72,000 per year. And then Made in America. This program is to ensure the future is made in America by all of American workers, which is launching a whole of government initiative to strengthen the use of federal procurement to support American manufacturing. To continue building on these implementation efforts and ensuring the ambitious goals aren't just talked about, but action, The executive order established the creation of the Made in America office within the White House Office of Management and Budget, which is also known as OMB. The Made in America office works to implement federal procurement and financial management policy to help carry out the president's vision of a future made in America of all American workers, including minority entrepreneurs and small businesses in every region of our country. To find out more about this program, you can go to madeinamerica.gov. And with that, we conclude today's webinar. If you have any SBA related questions, please feel free to email answerdesk@sba.gov. And if you have any questions or would like a copy of this webinar, please feel free to contact us at events@publicprivatestrategies.com. Additionally, our next webinar will be on December 21st at 2:00 Eastern Time. And the focus of that will be closing down for 2022 and how to prepare your business and setting it up right for 2023 to be on track. So we look forward to seeing you there and have a great weekend.